and welcome to YouTube channel HealthQ, the place where my mission is not only to motivate you and help you to move on to the brighter side of the health. In today's video, I'm going to explain you what is EMS or else electrical muscle stimulator. Now, whenever you go to any physiotherapy center, you must have heard of this name or this term. Ultrasound, IFT, TENS, EMS are some of the most popular physiotherapy modalities that is being used globally. Now, these modalities have got various use, various benefits and sometimes contraindications as well. That's the reason I'm making this video, to give you a basic understanding about these terms, about these modalities. So whenever you go next to a physiotherapy center, you will exactly know what exactly this machine is going to do for you. So without wasting any new time, let's get started. So today's machine which I'm going to talk about is EMS, also known as electrical muscle stimulator. As the name suggests, we are electrically stimulating a muscle, and the machine that does that is electrical muscle stimulator, right? Now this electrical muscle stimulator basically uses two types of currents. So electrical muscle stimulation is a process through which a muscle is stimulated by two different forms of current. Usually these form is called as Faradic current and galvanic current. So what is the difference between this Faradic current and galvanic current? The difference is in the amplitude, or else you can say how strong a contraction is going, or else how strong the current is going, and the pulse width. What do I mean by pulse width? Whenever a current is passed, right, it will cause a pulse contraction and then a relaxation. The more wider the pulse width, it becomes galvanic current. The more shorter the pulse width, it becomes a Faradic current. Okay, so there are different uses of this galvanic current and Faradic current, but both the scenarios are used in therapeutic scenarios. So as I mentioned, electrical muscle stimulator or electrical muscle stimulation is used in different conditions. Two types of currents are used. Number one type of current is a Faradic current and another type of current is galvanic current. The difference between these two currents is in its amplitude, or is the strength with which the contraction goes, and the duration of the current. How long the duration or how long the current stays in the body and then relaxes. Because in both the scenario there would be a contraction and relaxation. Contraction and relaxation. Alright, so now when it comes to electrical muscle stimulation with Faradic format, this type of current is usually used in stimulating the muscles which are already having good nerve supply, right? So if a muscle has become weak but the nerve is absolutely intact, and if we want to strengthen that muscle, in those scenarios we will use Faradic muscle stimulator. But at the same time, if a muscle has undergone damage due to damage to a nerve, which means a good muscle is not getting proper nerve supply due to damage to the nerve, which in medical terms we also call as a denervated muscle, in those scenarios we use galvanic current. Both of them are a form of electrical muscle stimulation only. So whenever you will go to a physiotherapy center, your prescription will say electrical muscle stimulation. But what will vary is what is the type of current that they are using, whether Faradic or galvanic. This will depend on what kind of injury or problem you are working on. Now, when all the galvanic kind of current is used, as I mentioned, galvanic current is applied on a denervated muscle, which means if you have gone through any sort of nerve injuries, peripheral nerve injuries, at that time galvanic muscle stimulation is used. So let's say if you have got a nerve injury like let's say a brachial plexus injury, radial nerve injury, peroneal nerve injury, or a medial nerve injury, if you have got injury due to carpal tunnel syndrome where a nerve damage is involved, in those kind of scenarios the therapist will give you galvanic current. Even many a times galvanic current is used to stimulate facial muscles as well. But that's another topic. I will not like to go into that because it has other side effects. So usually it's a controversy whether it is used, it should be used or not. But again, yes, it is used by many therapists. In that scenario also, what they use is a galvanic type of current. The second type of current, which is Faradic kind of current, is used for strengthening the muscle. So let's say if you have gone through a nerve injury, now you have recovered and now you are working towards strengthening those muscles, right? At that time, Faradic stimulation would be used. Faradic stimulation would be felt more strongly compared to the galvanic stimulation because there is a contraction, a strong contraction, and the relaxation is faster. So you will feel it more strongly. You will feel that contraction and relaxation. You would be able to hold that contraction if you want to. But in galvanic kind of stimulation, you will feel more of a piercing kind of sense because here the current is going to the muscle or to the nerve, stays there for long so that it can stimulate the nerve, right? And then it relaxes. So a current stays for longer duration in your body in the galvanic scenario. That's why you feel it more piercing compared to the Faradic stimulation. So I hope this gives you a clear understanding about what is the galvanic kind of current and what is the Faradic kind of current. Now, how does this helps? Both the scenarios are used, right? In different scenarios, the effect is also different, but overall what it causes is it enables good muscle contraction. A muscle contraction is compromised in any of the pathological scenario. It could be due to injury, it could be due to muscle spasms, it could be due to some health conditions, right? In all the scenarios, electrical muscle stimulation will help to optimize the muscle contraction, to make the quality of muscle contractions good. Second, it will improve the metabolism of the muscles. Whenever a muscle is not contracting and relaxing properly, what happens? The blood circulation, the lymphatic drainage, the cellular interconnection, that also gets compromised, which leads to a lot of toxin accumulation, which leads to a lot of accumulation of fluids in the body, which could be the leading cause of edema sometimes, right? So, in order to maintain good metabolism of a muscle, electrical stimulation is helpful as it removes the waste products. The third use is of re-educating the muscle. Whenever a muscle has gone through injury, whether it's a nerve injury or muscle injury, it needs re-education, it needs retraining. In all those retraining, electrical muscle stimulation is helpful. Electrical muscle stimulation will train the muscles to contract and relax at different intensities, at different strength level. And that's what is also a very key benefit of using electrical muscle stimulation. The fourth important use of electrical muscle stimulation is to prevent muscle atrophy. Whenever a muscle again goes through injury or spasm or is at lack of movement, what happens to this muscle is they loses its thickness, they loses its girth, they become thinner, shorter. This thinness or shortness can be improved with the help of electrical muscle stimulation. And that's why electrical muscle stimulation is helpful. Now, as I mentioned, electrical muscle stimulation is used in many conditions, starting from injuries to muscles like ankle sprain, strain, quadratus strain, or leg strain of other kinds, nerve injuries like foot drop, wrist drop, etc. In all kind of situation, electrical muscle stimulation can be used. What kind of current to be used varies depending on what is the stage, and that is an absolute discretion or decision of a physiotherapist. Having said that, there are some contraindications of using this device as well. Physiotherapist has to be cautious while using this device sometimes. So it's important for you also to know what are these caution or precautionary measures, or you can say red flags when you should not use electrical muscle stimulation. Number one red flag or contraindication of not using electrical muscle stimulation is an open injury. If you have got any kind of open wound, blood is coming out, if you've got stitches, those areas you should avoid using electrical muscle stimulation, because that could hamper your or else alter the blood circulation in that area. So that has to be absolutely avoided. If you have got poor sensitivity, if your sensory nerve has been damaged, if you can't gauge the severity of the current, in those scenarios you should not use electrical muscle stimulation. you should make sure that wherever you are using your electrical muscle stimulation or applying your electrical muscle stimulation, you have got good sensory function. You should feel the touch, you should feel the pain, you should feel the heat, you should feel the current. Those sensations should be intact while using electrical muscle stimulation. If you have got some other dermatological condition, let's say psoriasis or any sort of infection, yeast infection, fungal infection, in those scenarios also electrical stimulation should be avoided. And last but not the least, if the area where you are applying electrical muscle stimulation, that area has got some sort of cancer affection or else have got some inflammatory tissues present, or even if your body has got cardiac pacemaker, in those scenarios also you have to refrain from using electrical muscle stimulation. So that was a brief about electrical muscle stimulation. I hope I was able to simplify in making you understand what exactly is electrical muscle stimulation, where it is used. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.